Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
Hello and welcome to a special edition of Health Today. Today we have a very special lady with us and she's going to tell us about a very special device. Her name is Angela Francis. She's a director of Caribbean Telehealthcare Services and the device is called the Safe and Well device, Angela.
It is called Safe and Well. And what it actually is we have a home unit. So if you've got someone who spends time alone at home or lives alone, it'll be a unit that goes into their home and they wear the pendant. Should anything happen to them, an emergency, any incident, all they need to do is press the button on the Safe and Well home device.
This is something that we would have seen on American networks and UK networks for a while.
You've been seeing it for probably about 27 years and keep wondering, why is it not here in Barbados? Well, it is. We went 24 hours last January 2014, and it's here now as a service that we're offering. So
anybody in Barbados, any demographic can have access to this device in terms of whether you have a relative at home, as you said, that might have a health ailment. You just press this device and you can get emergency help.
Yeah, this device is for anybody who wants to keep safe, essentially. So it can range from our grandmas who are at home spending time alone to a 14-year-old daughter who suffers with asthma and just wants to have that ability to summons help quickly at the press of a button.
How many Barbadians are aware of this? Some people have taken advantage of this device since
the response has been fantastic, and it's on the backdrop of people seeing it on the American cable TV. So they are aware of the product. I think it's well overdue for being here in the Caribbean, and they're really keen, to have the service. So yes.
How reliable, though? I mean, if we're going to be summoning health services for our relatives, that gives us some level of comfort, but you want to know that it will actually come.
Yes.
That it is reliable.
A couple of things that to give you some reassurance. So once we receive an activation, we're actually able to open a two-way conversation, and we will stay with our client on that two-way conversation until help arrives. Now that help can be in a number of different forms. It can be an emergency service, so your ambulance service, your police or the fire brigade, depending on the situation. It may be a daughter or a son who needs to come around and help you. Maybe you've fallen, not too much of an injury, but just help you to get up. There are challenges around, the QEH ambulance sometimes. So what we've done is we've built a strategic alliance with a private ambulance service, and that's Island Care. So where we need to, we can always call Island Care as a backup for an ambulance service.
And can you choose where you want to go, like QEH or Review?
Absolutely. What we do is when we do sign up new clients, we take instructions from you. So you may say, I want my ambulance service to be from Bayview. You may say, I only want to go to Bayview or to Sandy Crest for my treatment, and we will follow your instructions. Whatever you ask us to do, that's what we will do.
What about details and private medical information? How secure is that? That's another thing. People don't really like to give access. I personally don't like to give access to private information, but how secure is this system?
First of all, it is important for us to have that information. So along with your personal information, your name, where you live, date of birth, etc., it's essential for us to have information regarding your medical conditions, any medication you're taking, your doctor's details, because that helps us to assess a situation as and when it arises. In terms of security, we're as secure as more or less everybody else, because we know how important medical information is and personal data is as well. So yes, we're very secure.
Any recourse? Let's say my relative beckoned and nobody came?
Yes, we have. We've got the insurance, so we're with a particular insurer and we've got those policies in place, but that's not our experience. We have very reliable equipment. We do rely on the GSM network. We do rely on third parties. So we do have the normal disclaimers, but we've not had that experience so far.
To date, what has been your reliability level? 100% or?
Yeah, I would say we're probably around about the 97 percent. So we really are up there in terms of reliability.
And what happened in that 0.3%?
Yeah, well, we have a backup. So what happens is our main platform is a cloud-based platform, but then what we also have as a backup is a regular telephone system. So if for whatever reason you were missing our cloud-based platform, you would still come through, your activation would come through to our telephone system.
Okay, and it is available, as you said, across Barbados, right?
It is right across Barbados, and we're also rolling out across the Caribbean. So we next go into Jamaica to duplicate the service there.
Okay, so this is the first in the Caribbean, Barbados?
Yes, we incorporated here in Barbados. We particularly chose Barbados because we're connected and for a number of other reasons. So yes, we started here, but we have pinned it down. We've been here, as I said, 24-hour service since January last year. So we now roll out to some of the other islands.
And Jamaica's next, but in terms of cost, though, everybody would want to know.
Really important question.
The cost,
really important
question. This sounds very
question.
impressive. You're going to be able to press a button and get somebody to respond to your relative. What is this going to cost me?
Yeah, you're going to be really, really surprised at how affordable it is. So if you talk about one of our home units, it's 299 Barbados dollars to buy that unit and install it into your home. And then for the 24-hour remote monitoring, we're there 24 hours a day because anything can happen at any time. $49.99 a month. Isn't that fantastic?
Just $50 a month, basically,
to save a life.
And so the initial cost.
Yes.
Is just a one-off cost.
It's a one-off cost.
And then I pay the $50 a month, and I have that protection in terms of a relative.
You do.
And this is the basic system. Of course, there'll be a higher end system.
There is. We do have a higher end, and it's more sophisticated because with that unit, the pendant you're wearing, you're actually able to have that two-way conversation through the pendant. So suppose mom's in the garden, way down in the garden, working the land, etc., and she has an incident. Suppose it's a fall, which is a classic situation, our elders fall. She'll press the button on her pendant, and we have that two-way conversation through the pendant. That's the sophistication, and that product is $1,399. But the monitoring is the same, $49.99 for that monthly monitoring.
How do we access this app?
Well, you can call us. So we're on 228-3633. That's 228-3633. You can also access us through the web. We have a website, and that's www.caribbeantelehealthcareservices.com. And we're also on Facebook. So facebook.com/Caribbean Telehealthcare Services.
And you can sign up, of course.
You can sign up, yes, definitely.
And there's a specific app to deal with this?
There is. What we do, for our clients who are very active and away from the home, we provide, particularly for our seniors, a mobile phone. So that's a handset phone. Two important features with that phone. In the back of the phone is an SOS button. So if anything happens, when they're out going to church, going shopping, they simply press the button. That works exactly the same way. It also comes with GPS location tracking. No matter where mum is, dad is, we can find them once they have that phone. For our younger clientele like you, we do that as an app. We do an app which will sit on your smartphone, and that will work exactly the same way. So any incident, any emergency, you press the app on your phone, and that again will come through to our monitoring section.